Hi, this is Josh. I'm a pharmacist with pharmacisttips.com. Gonna talk a little bit about the medication cephalexin, some of the frequently asked questions about cephalexin. We're gonna touch on alcohol, Tylenol, Advil, sun exposure, milk, dairy, metformin, and pregnancy. Okay, first off though, what is cephalexin? Well, it's a cephalosporin antibiotic. It's used to treat infection or prevent infection, common infections, bone, urinary tract infections, ear, respiratory, skin, as well as others as determined by your doctor. Adult dosage does vary anywhere from 250 to 500 milligrams. We can see that taken up to 4 times a day. We do want to try and spread our doses equally throughout the day so it maintains a constant level in the body to fight that infection. It may be taken with food if stomach set occurs. Food is not necessary. What about drinking alcohol? No interaction has been noted. You're not likely to have a reaction. But, if you have an infection, you probably do yourself a favor, lay off the booze while you're on it. Might help you out. But if you're in a social situation and need to have a drink or two, it doesn't seem like you're going to have any reaction there. But it's probably best to avoid if you're fighting an infection. What about Tylenol, Advil with cephalexin? No significant reactions have been noted. Most people can take what their regular cold preparations or anything for symptomatic treatment while they're on cephalexin. If you can use them normally, so if you tolerate Tylenol and Advil on a normal basis without issue, then there should be no issues here. If you're not certain if you should use Tylenol or Advil, because remember Advil is in the NSAID family. Those can increase blood pressure. They can be a little hard on the stomach. Usually that's more with long-term use, not a short-term use. But if you're at all uncertain whether you should be using those, go ahead and just chat with your physician or your pharmacist. Make sure that that's okay, but it doesn't interact with the cephalexin. About sun exposure with the cephalexin, it's not been reported. So photosensitivity is how you often see it listed in the medical literature. Not been reported, but you should always be mindful of your sun exposure. Um, you know, just don't need to be out in the sun a long time without some sort of protection. We don't want to get sunburned. Milk and dairy products with cephalexin doesn't seem to be a big issue. The medicine can be taken with or without food. So, if you get some cheese or glass of milk, that's going to be all right. They don't affect that. It does seem like multivitamins would be best to be avoided. It seems like the zinc might reduce the effectiveness of that medication. So that'd be one thing to keep in mind. Just don't take your multivitamin at the same time while you're on the cephalexin. What about metformin? Metformin, there is an interaction with metformin. The cephalexin can increase metformin levels. Is that a big deal? It depends on the person. It can also depend kind of on kidney function. Your doctor may determine to reduce the dose. Many people are going to tolerate it without even noticing. So it's kind of up to you and your physician or your healthcare provider. We always want to watch for side effects. If you're at high risk of side effects already for metformin, then that's probably when we need to be more mindful. But do contact your provider if you're uncertain about that, or if you are using metformin and cephalexin and you think you're having side effects. But typically, a 7 to 10 day cephalexin prescription we wouldn't get too worried about, but again, highly variable on the person. Pregnancy and cephalexin, it's categorized in category B, meaning it's considered safe. Animal studies did not show adverse events. It does cross the placenta. However, that's not been shown to cause any issues. Birth defects have not been noted. But as with everything in pregnancy, it's a risk versus benefit. You talk it through with your physician, your OB, make sure because certain infections can be detrimental to mother and baby. So oftentimes taking an antibiotic is a good idea because it reduces the other risks. What about penicillin allergy? Yes, there is some what we call cross sensitivity. It can occur. Some estimate like 10%, 1 in 10 people can occur. Um, your doctor will determine the extent that we have to worry about this usually. It all depends. How severe was your penicillin allergy? Some people just say, well, penicillin upset my stomach. Well, that's not an allergy. And so you can often use cephalosporins. If you had a terrible allergy, rash over your whole body, difficulty breathing, then yeah, we probably wouldn't use a cephalosporin. But there's many factors your doctor will take into consideration, the type of the current infection, and again, the severity of allergy, and they can kind of determine your risk of a reaction there. I appreciate you watching. I do hope you found this information useful. Be sure you always talk to your doctor or pharmacist if you have any issues, side effects. Always be mindful of side effects. Often, the sooner we notice them, the sooner we stop the medicine, the sooner they resolve. And I'd love it if you'd subscribe to my channel if you find this information useful. Thanks for watching.